Thank you for having me today. I'm also a plaintiff in the Zurawksi case, and I'm here. I'm here because this is very personal to me and to my family. But again, I yet to hear something in these rules that sounds like it will address what happened to me and my family. My child was diagnosed with a host of genetic conditions, one of which was osteogenesis imperfecta, or brittle bones, meaning that if I bent down to pick up my toddler son while I was pregnant with my second child, I would run the risk of breaking his bones. The mental anguish of carrying that pregnancy to term would have killed me. It would not do any bodily harm, as you've listed in your rules, but I probably would have taken my own life to end my child's pain. So I do hope that you will consider the recommendations of a mental health professional in your two-provider rule for reasonable medical judgment. I've heard you say that you don't make the law, but I'm here today because I've tried to get the legislature to act when I lobbied last session and couldn't even get an amendment for fetal anomaly out of committee. I've tried to get the courts to help explain what would happen in my situation as a plaintiff in the Zurawski case, and they said that we needed to wait for you. And now you're saying it's not your responsibility either. So where else am I supposed to go? Again, I want to be very clear. Your ruling did nothing to address fetal anomalies that hundreds of women face. I would have given my life to take away my child's pain like any mother would. Your decision to leave fetal health out of your rule will only leave confusion for providers who are counseling parents who are doing the best they can. This is what abortion bans do. They strip away dignity and autonomy from pregnant people, and they take away our rights to decide what is best for ourselves and our families. In my case, having an abortion was a compassionate parenting decision, but regardless of anyone's need for an abortion, these bans set up pregnant people to feel like criminals, forcing us to beg for empathy from the courts that have now normalized suffering and dehumanization of women and mothers. I am here today because I had an abortion. There was nothing that could have been done to save my child's life, but an abortion saved my life. And it made it so that I could be here today to stand up for the other hundreds of women who face situations like mine. So thank you for hearing my statement.
And again, like I said earlier, thank you for coming and, in a public setting, being able to tell your story like that. I know it was not easy, and so thank you.